Now, we will give the floor to Dr. Ahmed Al-Mandari. The floor is yours, sir. In the name of God, the most gracious, the most merciful, and may peace and mercy and blessings of Allah be upon you all. Thank you very much indeed for all the colleagues who have joined us today for this meeting. Dear colleagues and friends, thank you for joining us here again today for the latest updates on COVID-19, as well as updates on some of the work that has been happening on a regional level to help countries manage this outbreak. In the past few weeks, since many of you were last here, there has been many developments in terms of both the spread of the outbreak as well as much progress in WHO's response in support of countries. Today we have been informed that the confirmed cases of COVID, 167,000 and 115 cases in 150 countries globally. This includes 6,606 people who have died from the disease. In our region, 18,000 case 19 in 19 countries have been reported, including 1,010 deaths reported from 7 countries. We are now seeing more and more cases of local transmission, and this requires to accelerate and close ranks and efforts. Over the past few weeks, a team of experts from WHO, together with other public health experts, have undergone joint missions to several countries in our region where cases have been reported. While I am currently speaking to you, more missions will be sent. Other countries have also requested support from WHO. The objectives of the joint missions determines the dynamics of transmission and at-risk populations, provides guidance on strengthening and scaling up the response to the pandemic, and including strengthening and scaling up the response, as well as identifying priority control measures and provide guidance on strengthened preparedness for areas not yet affected by the pandemic. Today, we have with us colleagues who have just returned from Iran, Bahrain, Kuwait, and Iraq, and who will be able to clarify to you the role that WHO is playing to support countries in their readiness and response efforts for COVID-19. They have conducted extensive meetings and field visits to identify areas of work that can be strengthened to ensure that patients are quickly identified, tested, isolated, and safely treated, that contacts are traced, and that at-risk populations are protected. Before I talk about these areas of focus, let me take a moment to address the current efforts of countries to fight this disease. Frankly, we are seeing uneven approaches across the region. While we have observed impressive progress in several countries, not all are yet applying the whole of government and whole of society approach that are absolutely needed to effectively prepare and respond. We need the highest levels of government, not just the ministries of health, to take full ownership of the fight against coronavirus. This is one of the most important messages that I can convey to you today. The countries that have made the most progress are those that have engaged all ministries and sectors effectively, including both the private sector and civil society. They are the ones that are providing accurate, transparent, and timely information for their people about the current status of the pandemic, the preparedness actions being taken, and the measures that individuals can take to protect themselves and their families, including the importance of social distancing. Across the region, our teams have observed brave and dedicated doctors, nurses, and other health staff working on the front lines of this pandemic and doing their best to save lives despite the challenging context. They have witnessed efforts to strengthen disease surveillance, to rapidly scale up of laboratory testing, and to support families who are isolating loved ones with the disease or who are in quarantine themselves. But much more needs to be done. In most countries, we still have time to more rapidly accelerate our efforts. We believe that proven containment measures of early detection, early testing, early isolation, early treatment, contact tracing, and community engagement represent the best measures to control the pandemic overall, that across the regions where countries have reported cases, we have identified several areas that need strengthening, including strengthening disease surveillance, preparing hospitals, protecting health workers, and educating communities. However, the global shortages in medical supplies and protective equipment for health workers pose challenges to our ability to deliver the required amounts of supplies to countries who need them. Our logistics hub in Dubai's international humanitarian city is therefore playing a central role in ensuring that countries across the globe are receiving the supplies they need to prepare for and to respond to possible cases of COVID-19. So far, all countries in the region have been provided with laboratory reagents, personal protective equipment, surgical gowns, and other supplies. In addition, the logistics hub is also ensuring the delivery of similar supplies to other countries in all 6 WHO regions around the world. As you may know, information about cases in the region are shared with WHO in accordance with the international health regulations. Unfortunately, even today, as the situation is becoming critical, information on cases is insufficiently communicated by countries to WHO. I would like to stress here the importance of sharing information with WHO regarding identified, suspected, probable, and laboratory confirmed cases through IHR channels. We can only control this disease if we have access to information that allows us to understand its dynamics in the region. We still need to know a lot about this new virus, so we need to track its spread closely and quickly apply the proven public health measures that can help us contain it. We will all benefit when we have clear information about the pandemic, how the pandemic is evolving in other countries. Hence, we all have responsibility to report in a timely manner. Let me here also stress the difference between underreporting and underestimation of confirmed cases. There has been much coverage in the media that some countries are not revealing the true numbers of reported cases. As you all know, the nature of this virus affects people differently. The majority of people experience mild cases and do not seek medical care, while others have more severe cases and seek medical care. As a result, it's almost entirely the severe cases that are captured in disease surveillance systems, but it is probable that in all the countries in the world, there are many mild cases that are not identified. As a result, we can say that there may be an underestimation of the cases. This is an issue for almost all countries, even those with developed health systems. Several countries in the region have conducted their own risk assessments and have subsequently taken measures related to closure of schools and cancelling of mass gathering events. National authorities should make evidence-based decisions about these types of issues, and WHO's role is to provide public health recommendations if such decisions are made by the governments. Many countries are also implementing travel and trade-related restrictions, including suspensions of flights and closure of borders. WHO's positions on this remains the same. Travel and trade restrictions or border closures are not generally recommended. When they are applied, they must be based on a clear risk assessment and be proportionate to the risk. Any such measures taken by countries must be reported to WHO along with the scientific evidence and rationale within 48 hours of their implementation. Restrictions on travel also impede our ability to fulfill our role properly as WHO by delaying the deployment of public health experts to countries that need support, and delaying the delivery of urgently needed supplies to support health systems scale up their capacity to detect and respond. Describing the situation as a pandemic does not require countries to only focus on placing more restrictive measures on travel or trade. It does not change WHO's assessment of the threat posed by this virus or its recommendations. All countries must strike a fine balance between protecting health, minimizing economic and social disruption, and in case of any travel-related restrictions or social distancing measures, this must be implemented while scaling up health system capacity to respond. Active search for cases, aggressive tracing of contacts and treatment, isolation and quarantine is relevant. The protection of healthcare workers is also critical, as they are the core of responding to this pandemic. Every country has a responsibility to protect health workers and augment their knowledge and skills on investigation and management of this pandemic without additional personal risk. Dear colleagues, let me repeat. We need urgent and strong commitment within governments, the health sector, and the society overall to control this outbreak. This disease can primarily be controlled, God willing, through aggressive actions related to finding cases, isolating them, testing them, and treating them. Countries that continue finding and testing cases and tracing their contacts not only protect their own people, they can also affect what happens in other countries, regionally and globally. Rigorous risk communications and community engagement support these efforts. Finally, the time to act is now. I cannot stress enough the level of urgency with which this needs to happen. We have an opportunity to contain this pandemic in our region, and we must all work together to make this happen. May God speed and protect populations and nations all over the world. Thank you very much indeed. Thank you, Dr. Ahmed Al-Mandari. In fact, there is a question relevant to what you have mentioned right now from Aya Alauddin Muhammad. She is from Phoenix TV, Hong Kong, and she's asking, we do know that WHO, or there is a reference that WHO is calling upon all the countries of the region to give further information on the status of coronavirus in their respective countries. And you've said that countries is only reporting 20% of the information. And despite the announcement of pandemic, there is countries like Syria, Lebanon, and Djibouti have not actually surveyed any cases. Is this due to weak capacities of surveillance in such countries, or is it due to the lack of the presence of the virus? Thank you very much indeed for this important question. As I've mentioned, we need to differentiate between the underreporting and the underestimation of cases. As said, this is a new virus with a new nature. Science is still investigating information via data coming from different countries vis-à-vis this virus and the nature of people infected and the ages of people infected, as well as the severity of the infection. That's why we understand this disease day after day. As you may know, the region, or 2/3 of the region, suffer from crisis, whether they be new crises or old ones. Such crises, with its different types, have impacted the efforts of health systems with regards to human capacities and financial capacities, as well as equipment in order to detect the disease. Yet despite all such matter, WHO works rigorously with the specialized agencies in such countries, particularly ministries of health, to scale up their capacities since it was announced that this is an outbreak before it turned into a pandemic. This started from points of entry, from airports, and from other places in order to identify the infected persons, isolate them, provide them with proper treatment, to follow up the contacts, and to take different health quarantine measures. So, underreporting on the part of some countries with regards to positive cases is present within a very simple figure. But despite all such matters, WHO, whether the country Office or EMRO is in continuous follow-up with such countries in order to contain any kind of imbalances because that has led to underreporting. Thank you. We have a question from CNN with regards to the situation in Egypt. The question reads as follows, and the person asking it is Mary Rogers from CNN.
Hospital should the virus escalates as it did in countries like Italy. How many respirators are in Egypt? How many COVID test kits are in Egypt? And so on. And how many people have been tested so far?
I will give a quick piece of information, then I will give the floor to Dr. John Rabour, who is the representative of WHO, because he has many details. As everyone knows, all the countries of the world, whether they have developed health systems or those who suffer from shortages of resources, are indeed alarmed with regards to the availability of capacities to provide the healthcare needed for the patients. In the hospitals, there is shortage, a severe shortage, in fact, with regards to the availability of the beds in intensive care and isolation rooms. This is in most countries of the world, but health systems via the pandemic aims to strengthen its health systems by providing capacities and resources. It's indeed a good opportunity to strengthen our health systems. Thank you.
Dr. Ahmed, also to add what Dr. Ahmed said, this is a true fact. And WHO in Egypt, the main concern that to make sure there is a plan and there are hospitals included that can respond to such progress in the number of cases. And this is what is happening between the World Health Organization and the national authorities in Egypt, where at the beginning we have a plan. There are a list of hospitals. The most important part, we as WHO working very closely with the government to make sure that they can respond in a better way to the surge of cases if it happened in Egypt. And this is our main concern. And WHO is working closely with the Ministry of Health and Population in order to update this plan, in order to update even the list of referral hospitals, the list of isolation and treatment hospitals, and the most important, the testing sites, in order to cope well with the increased number of cases if it happens. Thank you.
Part of the question was, Dr. John, part of the question was how many cases, confirmed cases so far in Egypt, and how many people have been tested?
We have 196 confirmed cases until now in Egypt, and out of 3,015 suspected cases tested so far in Egypt.
Thank you. لدينا سؤال.
We have a question. If Dr. Mahrabat could answer to it, it is relevant to vaccines and the wave of worldwide panic and alarm. The question says that the countries are racing to, there are 5 countries racing to find a vaccine. WHO mentioned previously that the time it takes to reach a vaccine takes from 12 to 18 months. So the question is, how far could we reach a vaccine in the near future? And the second part of the question is, there is a wave of panic and alarm worldwide. Is it justified? The name of the person who posed the question is Aziza Fuad. She is the head of scientific section in Al-Ahram newspaper. Thank you for the question. Thank you, Dr. Ahmed. With regards to the first part of the question, with regards to treatments and vaccines, there are worldwide experiments done globally to reach the proper vaccine quickly or to reach the proper treatment quickly. It is until now under experimenting. In order to safely say that there is a vaccine that could be approved and accredited and could be used worldwide, we do have scientific measures that it should undergo or scientific phases that this testing should undergo. So the best estimations would be that we would come up with a vaccine and the proper timing in order to be approved for use globally for humans and communities. So when we speak about that, we would say that the status quo necessitates that we resort to innovation and come up with innovation and research. And this takes place globally and in a very accelerated manner. And we still need sufficient time in order to approve that such vaccines or such medicines could be used on a bigger scale. However, there are very well-boding initiatives in the near future, but the near future does not mean a month or two. But if we take into view the needed time for testing or clinical trials on humans, it takes time. And I believe from my personal viewpoint, this would not take place except after a year, 12 months at least. This is the best approximation. But with regards to the spread of panic and fear worldwide, it's not a panic of a fear wave, but rather it is a desire to provoke societies, communities, and persons to take necessary procedures to confront and contain the disease and to stop the spread. How could we communicate the information and how could we pursue political mobilization and community mobilization in order to take the proper procedures and in order to say that every participant in this community has a role to play and a responsibility to shoulder, whether a governmental one or a community one, and both are equally important. Hence, we need to convey the information properly. We need to convey the dire need to take the proper decision and proper action in a timely manner. When we want to act, we do not look to the past, but we look to the present, and we say there is an urgent need to act now, and everyone should shoulder his or her responsibility and fulfill it completely. And every participant should take proper decisions regionally, globally, and on a country level. What's pivotal is that we say when the information is communicated to everyone, does it provoke worry, concern, and does it lead to taking more sound procedures, or does this fear and panic make us feel that all the efforts are futile? All the effort, all the procedures taken show that there is an opportunity available before us to contain the disease following the proper procedures and shouldering the proper responsibility. Every person is responsible on what is taking place and what is implemented vis-à-vis procedures. We do say that every person has a responsibility to share. Panic does not mean simply to be apprehensive and to spread rumors and to look at what is said in the media, but the information we receive and every consequence is done to raise awareness and to raise the positive engagement. Thank you. Thank you, Doctor. There's a question to Dr. Rana Al-Hajja. Dr. Rana?
Back from a mission to Iraq, and we have a question from Zhang Yuko from People's Daily newspaper in China. He says that China has sent expert teams to Iran and Iraq to help combating the COVID-19. Is WHO EMRO playing the same role and planning to cooperate with China in a similar way? Dr. Rana, do you hear me?
Okay. Yes. Hello.
Hello.
Yes. Thank you very much. It was muted from your side. Thank you very much for the question. Yes, we just came back from Iraq. There was a small team that included all the key aspects of the response, including epidemiology and surveillance, infection control and case management, as well as laboratory communications, ports of entry, and other. We did actually meet with the Chinese team of experts that was there in Baghdad, which also included many technical experts in all areas, in particular many from the clinical side that actually shed quite a bit of light on the case management of cases in China, and it was very helpful to share their experiences. Also, it would be nice to mention that the Chinese team brought with them many supplies as donations to the Iraqi government, which were very much appreciated. This included laboratory supplies and kits, machines as well as kits, and also it included some PPE, personal protective equipment, and other. So I think these kind of visits by China, I've heard there were similar teams that went to other countries, are very useful to share the experience in the country. Over to you. Thank you.
Thank you, Dr. Rana. We have another question. I guess maybe Dr. Richard Brennan can take it if he is with us. Dr. Richard, are you connected?
Yes, I am.
Thank you. The question is from Asia Times, Alison Muse from Asia Times, and it reads, what unique risks do the region's refugee and IDP camps face, and what measures are being taken to ensure these communities, A, do not come into contact with the virus, B, are able to get tested, treated, should they show symptoms? Thank you.
Thanks very much. I think the refugees and the IDPs are a population within our region for whom we have a lot of concern. And WHO, together with the UN Refugee Agency, UNHCR, and the International Organization for Migration, we've just released guidance about measures that can be taken in camp-like settings and to address the specific needs of refugees and IDPs. Perhaps I can give you a specific example of what is happening. For example, in northwest Syria, where we do have a lot of internally displaced people, a large proportion of whom are accommodated in overcrowded camps. We are taking measures to put in place exactly the types of public health interventions that Dr. Al-Mandari mentioned, setting up improved surveillance systems. We're going to be starting testing in the Northwest very soon, by the end of the week, establishing isolation facilities for patients who are suspected or confirmed of having COVID-19, as well as really accelerating our work on reaching out to the community and making sure that they have the information in their hands. These are particularly difficult operating environments. The health systems are very weak. We are going to have to put more of an emphasis on the social distancing measures relative to some of the isolation and treatment measures, because we don't have as many resources in regard to healthcare facilities. So we are adapting our approach to the specific context of each refugee and IDP community. Can I just add one other point about the collaboration with China? This is very important to us in the region. And in fact, the mission that we just undertook to Iran, we had a senior member from the Chinese CDC as a member of our joint commission, as well as a colleague from the Robert Koch Institute in Germany. In addition, there was a team from the Chinese Red Cross in Iran while we were there. We had a degree of interaction with them, and in fact undertook a joint visit to one of the designated hospitals for coronavirus patients. And we are continuing to expand that collaboration with China. We have a lot of lessons to learn from the Chinese experience, and we are consistently sharing those lessons with countries in the region. And we've been impressed by how quickly decisions are being made to learn from the China experience and implement some of those important interventions that have been proven to be effective in China. Thank you.
Thank you. Dr. Dalia Samhouri, عندنا سؤالين.
We have two questions on travel restrictions and curfews. The question is from the French news agencies. What are countries does not need to impose trade restrictions and travel restrictions? Are there countries that do not need travel restrictions? And the other question, do you recommend to apply curfews in some countries or regions under the increasing number of confirmed cases? The second question is from Ahmad Askar from Masrawi. With regards to travel and trade restrictions, I would like to focus once again on the recommendations of WHO, namely that we do not recommend to impose unjustifiable restrictions on travel and trade, but countries, though, need to assess their own risks, and accordingly they would determine the additional measures that it could take into consideration. In the case of resorting to additional measures like travel and trade restrictions in specific countries or for specific locations and destinations, the information should be communicated to WHO within 48 hours, plus the scientific guide that has guidance taking into consideration. We find that many countries are imposing travel restrictions, and we do call upon countries to communicate information of such type with WHO. With regards to social distancing in general, whether curfews or closure of schools, closure of restaurants, or cancellation of meetings, etc. Social distancing is one of the measures that could be considered when there is a spread of the virus, and countries would follow measures in order to curb the spread of the virus and to give more time for the countries to resist the spread. I would like to focus also that in case or in the event the countries follow measures for social distancing, it should be based on risk assessment and it should be part of a full-fledged system. I mean to say that we cannot solely focus on social distancing and to fall oblivious to other measures which could be of more importance. For example, detection and identifying of cases, dealing with them expeditiously, preparation of health staff and hospitals, supplies, etc. Thank you.
Dr. Abdel Nasser?
Yes, I can hear you.
Okay, Dr. Amgad?
Hello?
Dr. Amgad Al-Khuli, are you with us?
Mona, can you hear me, Mona? This is Abdel Nasser.
لدي سؤال دكتور.
I have a question, Dr. Ahmed Al-Mandari. The question is from On TV. Ismail Lusimi, he says, is the budget of WHO, EMRO, capable of assisting countries when confronting coronavirus, and will it end with the coming of summer? Thank you very much indeed for the question. I will start by answering the second part of the question first. Will the virus come to end in summer? Allah only knows the answer to the question. Countries and WHO urges countries to strengthen their health systems to avoid further spread and more robust spread of the disease. By scaling up health systems and containing the spread within countries, this would enable us to curb the cases or confirmed cases over the upcoming period. With regards to the financial aspects and the resources in the East Mediterranean region, the needs are indeed huge, and we endeavor via different units, specialists and experts, whether in country offices or in EMRO or in the headquarters in Geneva, we urge them to communicate and with the donors and partners to provide financial and technical support in order to cater for the needs. As I've mentioned, the needs are indeed large. But luckily, and thanks to God, we find that there is support coming from different bodies, whether via direct financial support or technical support, and we do seek to get more support. And we do ask supporters as well to provide us more because the needs are huge. Thank you. I have a question with regards to the foreign communities present in Egypt. The question says the foreign communities in Egypt, in particular the Sudanese community, which is over 5 million persons, how do you deal with them via the media? And in case of infections amongst the foreign communities, how do you act? The person who poses the question is Salah Hassan from Wadi Nil Network, the Sudanese network. Thank you for the question. In fact, whether with regards to migrants or refugees, they are treated as part of the Egyptian community. In case of any infection, they follow the same system applied in the Arab Republic of Egypt. This is on the one side. At the other end of the scale, there is communication between WHO and the UNHCR and the International Migration Organization to organize matters. We're working together, and there is communication between myself and officials in order to organize work and action so that we would take any measures or procedures or deal with community brackets mentioned. With regards to the eruption of any infection, they dealt with just like any Egyptian citizen, and we coordinate with organizations at the highest level, and we also get further resources from international partners who are concerned with refugees or with migrants to Egypt. Thank you. A question to Dr. Maha. Is there a plan, a different plan on the part of WHO while declaring the pandemic and with the increase in numbers of infections? The question says, with the fact that many countries have announced that they have vaccines and treatments to the virus, but it hasn't been proven yet. The question is from Al-Ahram, from Ahmed Saad. What is plan B or the alternative plan of WHO in such a case? The global situation and the increase in the number of countries that have suffered from the pandemic, and at the same time, the geographical spread of the disease worldwide. This all has led to the characterization of the situation as an international epidemic. What should we do in such a case? We have fixed procedures and measures. Depending on the situation of every country and depending on the global situation, we do take more serious measures and we do take more rigorous measures, which should be done in a timely manner. So it's not a matter of different measures, but it's rather what are the measures that are actually taken in a package that leads to safely saying that we could contain the disease and contain the spread. The more we say there are bigger numbers or there's more spread or more of an outbreak or an epidemic, the package of measures are taken along with essential things that are taken. There is package of measures or procedures that are taken, as Dr. Ahmed has said. Some countries would close, some countries would follow social distancing in a very serious manner, but every country takes relevant procedures in a manner that is consistent with risk assessment to its case and inconsistent with capacities and inconsistent with its capacity to implement. WHO says that this does not mean we are moving from one situation to another, but rather we do need now to adopt programs and procedures that are more serious and more rigorous in order to contain the disease and contain the spread within the country and in neighboring countries. Here we need to say that what is taken in a specific country impacts the spread in neighboring countries, and hence there should be engagement, not only the technical engagement or information engagement or capacity and resource engagement, so that we could say that the procedures are taken rigorously. The risk is that we would take procedures or decisions that are not in a timely manner. Hence, we are saying that we should take such procedures strongly and rigorously and robustly in a timely manner, bearing into mind that all communities should be engaged and the whole of government should be engaged nationally and then regionally. With regards to vaccines and medicines, all such things are still experiments, and we do hope that soon it would be made available, and also the experiences we have learned from China or from European countries or from other countries are taken into mind. We need to share the experiences in dealing with the disease, and also we should have a future vision. I'm not saying that I'm taking my decisions for the status quo, but there are decisions and procedures that should be taken in the future. And you should take into consideration the changes in the dynamics of the epidemiological landscape, and hence all countries should be robust and resilient in health systems in the application of procedures and measures.
دكتور أمجد الخولي.
Dr. Amgad Al-Kholi.
دكتورة رنا.
Dr. Rana, can you hear me?
أنا شايفة حضرتك بتقولي yes بس مش سامعة الصوت.
I can hear you saying yes, but I can't hear you, ma'am.
طيب هننتقل إلى سؤال.
We shall move to a following question. Dr. Abu Bakr, are you with us? Dr. Abdel Nasser?
عندي سؤال من
I have a question from Al-Ahram Ashraf Amin. He says, what is the truth behind the news of the relapse of those who recovered from coronavirus, COVID-19, and how far would this disease turn into a more rigorous and more severe situation? With regards to the recurrence of infection, it's well known that when a person gets the disease one time, this gives the person some immunity from 3 to 4 weeks. But studies are underway to get to know the immunity the person gains after being infected with COVID-19. The possibility of reinfection is looming, but most of the cases have not been reinfected, and yet it's difficult to assess or determine the immunity period after being infected. With regards to the fact that the disease may turn into a more fatal one, the coronaviruses are not easily turning into fatal or severe or more severe ones. But we cannot judge the behavior of viruses, yet the coronaviruses are not known to turn into a more fatal or a more severe virus. Part of the question is, there any comment on WHO's regarding WHO's comment on the herd immunity? We have heard this in the UK. Have you heard about this, Dr. Amgad? Any comment on the part of WHO about herd immunity? Thank you. With regards to the policy followed by the UK, I would not like to comment on the UK in particular because it is outside of the EMER region. But in general, what we are saying is that countries are following different procedures, whether with regards to containment or mitigation measures. I mean to say, are there procedures to rigorously follow procedures like isolation or quarantine or follow the issue of herd immunity? We cannot say this is wrong or right, but we can safely say that any country could take the procedures it finds advisable according to the health status, according to risk assessment, according to the spread of the virus. This is on the one hand. At the other end of the scale, and regardless of any procedures taken by countries, it's pivotal to document the procedures followed in countries so that they would share experiences amongst countries later. Thank you. I'm not sure if Dr. Abu Bakr is with us or we cannot communicate with him.
I can hear you, but I think you cannot hear me. Hello?
Okay. Dr. Rana?
Hello?
Dr. Abu Bakr, can you hear me, please?
Yes, I can hear you. Can you hear me?
Okay. Can you raise your voice, please? Sorry, but the voice is a bit weak.
Can you hear me now?
Yes, I think so.
Go ahead.
Okay. The question is, السؤال جاي من
The question is from Iman Abdul Qadir al-Bawaba News. Is there a need to follow house quarantine or house isolation for all the cases to stop the spread of the disease, which is similar to a curfew maybe?
Well, thank you very much. I think the house isolation is recommended for the mild cases and close contacts of patients. Not all patients. Those who have severe symptoms, they need to be hospitalized and they need to be kept in the hospital. But the WHO recommendation clearly states that all mild cases, for example, and also the close contact, if there is no temporary facilities that can be kept, they should be isolated at home, and also for 14 days at least a minimum. And also after 14 days, all the cases need to be tested if they are negative or not. I think that's a recommendation for WHO, and the countries need to follow up on those recommendations where if there is no adequate hospital facilities, countries can use temporary health facilities as well as the home care.
Okay, thanks, Dr. Abu Bakr. Dr. Dalia, can you have a comment, right?
Thank you, Abdi. Thank you. Just to add, English or Arabic? Arabic. Okay.
I believe the question was as follows: if there is any benefit from imposing a curfew in countries or quarantine in all countries where there are cases. We'd like to emphasize that we need to abide by the terms and conditions set forth by every country. There are different procedures and measures, and the measures follow a risk assessment of every country. And I do iterate, risk assessment is pivotal, and risk assessment is followed by the country per se, not the WHO. We could assist technically in risk assessment in different countries, but countries take their own decisions and procedures like social distancing, curfew, closure of schools, etc. If the country is taking a decision in this vein, communities should abide by the decisions set forth by the country in order to ascertain that they would reach the objective behind such procedures and measures. Thank you. A question from Reuters. Eden Lewis is saying,
are being used in Egypt? How effective are those tests in detecting the virus? And is this testing being carried out widely enough?
First, let me say that the tests being used in Egypt are the same tests provided by WHO, and also those purchased by the government. They made sure that they are under the same qualification of those provided by WHO. The issue that in Egypt now they have widened their case definition of the suspect case, and since 5 days back they have included SARI as part of the suspect cases. If SARI negative, then they go for corona, and this is one, and they are taking the SARI manifestations. And this is what the main progress now in testing the suspect cases, and that's why we see an increase in the tests of suspected cases in Egypt. Thank you.
I have another question to Dr. Amgad. Dr. Amgad, you also أنت كمان دكتور أمجد.
Dr. Amgad, you've just come back from Bahrain and Kuwait as well. You were on a mission there. I have a number of questions on Bahrain in particular. The questions read as follows. What is your assessment of the initiatives taken by Bahrain up till this very moment in order to contain COVID-19? And is the number of cases in Bahrain consistent with the size of population and state? Thank you very much indeed. As you've mentioned,
وفد من منظمة الصحة المكتب الإقليمي زار البحرين والكويت مؤخرا. الوفد تضم عدة أفراد لتغطية أكثر من مجال، من ضمنهم الترصد والاستجابة، المختبرات وخطة الدخول، الاتصالات وقوة الاتصال والتواصل أثناء المخاطر، مكافحة العدوى والتعامل مع الحالات. أثناء زيارتنا للبحرين لمسنا بإيدينا مدى وجود آلية قوية في التنسيق برأسها مستويات عليا في الإدارة في البحرين. لمسنا في قوة كبيرة في اكتشاف الحالات، وخاصة التركيز الأكبر في ذلك الوقت كان عن الحالات الوافدة عند نقاط الدخول. في فحص لجميع المخالطين بيتم فحصهم وعزلهم في أماكن مخصصة لعزل الوافدين القادمين من دول ينتشر بها المرض بشكل كبير. كل هذه الإجراءات كان في مشاركة مجتمعية كبيرة وأكثر من مبادرة شعبية تم إطلاقها من ضمنها يسمى كلنا بحرين أو شباب بحرين. كل هذه المبادرات تؤكد وجود خطط قوية وزيادة عدد الحالات ممكن يرجع إلى أولا في عدد كبير من الوافدين من دول مصابة في ذلك الوقت، عدد زيادة الحالات بالإضافة إلى الفحص الكبير اللي بيقوموا به. عدد الفحوصات اللي تمت كان عدد كبير، وقت الزيارة كانت تجاوز 5000 عينة تم فحصها. ده كله أدى إلى اكتشاف الحالات بشكل مبكر. كل اللي طالبنا به منظمة دولة البحرين الاستمرار في مثل هذه الجهود، تقوية أنظمة الترصد وخاصة تلك أنظمة الترصد المبنية على الحدث، تقوية مشاركة البيانات وتبادل البيانات ما بين مختلف الجهات. لكن بشكل عام طلبنا توثيق تجربة البحرين كانت تجربة ناجحة حتى الآن في الاكتشاف والتعامل السريع مع كل حالة.
Treatment and dealing with every case as it needs. Dr. Rana, can you hear me?
Yes.
I can hear you. I have a question. I have more than one question from one body, where they say that coronavirus is airborne. It transmits via air. So would you talk about this, please? Thank you very much indeed. I do think it is important to respond to this question using the scientific evidences we have collected on coronavirus recently. We do know that it's not transmitted by air, but by droplets. And this is important to know because it impacts the epidemiology of the disease and means of control and protection of disease. There is one case where the disease may have actually been transmitted via air if the patient is in a hospital or in a health facility and he was exposed to some procedures that would lead to the spread of the disease by air. For example, if you are on a mechanical ventilation or the person is suffering from a short breath, and there are some procedures that may lead to the transmission of the disease via air, but usually the disease is transmitted via droplets or by touching a person who is infected, and it's very important to know that because accordingly we would come up with recommendations in order to extend protection from the disease and in order to provide community assistance and not to touch the same things the patient is touching. But again, this question has been reiterated in many instances, and unfortunately there are wrong information or misleading information on the media, and there is information that is being transmitted and broadcasted via media using the WHO logo. We need to make sure that this doesn't happen, and we'd like to thank also the media people for raising awareness of people. We'd like to urge people to resort to sound health information before spreading any messages. Thank you, Dr. Rana.
Dr. Richard?
Yes, I can hear you.
Yes. I have a question coming from from Russian news agency and from Mada Masr website and news site, sorry, and both are about, I'll read it in Arabic for accuracy.
With the inclination of some countries to release prisoners in order to combat and control the disease. What are the recommendations of WHO, and do confinement areas and prisons hotbeds for the spread of the disease, and what are the procedures that the WHO recommend? Thank you.
Thanks very much. So WHO is concerned about any setting where a large number of people are living in close proximity to each other or assembling in close proximity to each other. So WHO's guidance on that is more general in terms of the importance of all the protective measures that have been discussed earlier, the importance of social distancing to make sure that those types of facilities where it's not possible to decongest those types of facilities, that is as far as possible. There'd be good separation between beds within dormitory type settings, that social distancing of between 1 and 2 meters be maintained between the residents, that personal hygiene be attended to very rigorously, personal hygiene, hand washing, and that the residents are consistently informed and supported to adhere to those types of measures. So these are the general measures around hygiene and around social distancing that become even more important in overcrowded and congested settings, such as prisons, camps, dormitories, and elsewhere.
Thank you. Dr. Dalia?
Dr. Dalia, we have a question from Ali from Dar al-Hilal. He's asking, Were there any confirmed cases in Libya? And what about cooperation there under the war and under two governments? As Dr. Ahmed Al-Mandari has mentioned in the opening statement, there is a few number of countries that haven't reported any cases, and without delving into the details of such a matter, I would like to focus on the fact that it's not only about Libya, but countries undergoing different conflicts and disputes or different circumstances are being focused by WHO to give them priority when dealing with them in order to ascertain the presence of a disease surveillance system, human cadres, and basic guidance for the cadres to deal with different cases. Also, they have focused on, or WHO has focused with cooperation with different partners, and without delving into the different political disputes, I think the virus doesn't know any boundaries. It could be anywhere, regardless of whom or where. Hence, WHO's inclination and other organizations' inclination is to deal technically as soon as possible with all countries so that there would be a capacity to early detect the case and deal with this meticulously. Dr. Ahmed Al-Mandari, a question to you. The question is from Ali Al-Houthi, Dar al-Hilal, and Zaman newspaper. He's asking, what is your assessment of the regional and local capacities to produce vaccines, and how far does WHO help countries to develop such capacities? Do such countries engage WHO in their attempts to produce vaccine for coronavirus, COVID-19? As everyone knows, countries are racing in order to come up with this vaccine. As mass media means have been saying over the past days, there are experiments for new vaccines in the USA and some countries worldwide. Also in the region, there are some countries that endeavor to produce the vaccine in an accelerated manner, and WHO is working with all countries worldwide via a committee of experts in the headquarters in Geneva, not only for the production of vaccines and serums, but also for diagnostic matters and for the treatment in the form of medication. And we do hope soon that we would hear some good news. As Dr. Ma has said, the production of vaccine and using it extensively follows a number of steps that would endure for months in order to guarantee the safety of the vaccine. Thank you.
Dr. John, لدي سؤال.
Dr. John, I have a question from CNN once again.
Have died in villages in the Qahliya. Do we know how they contracted the virus? Are the villages under quarantine? The people in the village do not agree that their residents have contracted the virus. How are you countering?
You know, in the Egyptian communities, there are different traditions, and in this rural area, there is a more of Italian flavor for this village. And this is how, at the beginning, when they started, contracted the first case in that village and died, this was a gathering in a wedding. And this is what happened, and immediately the ministry took the measures in containing and quarantining the people inside the village, which is around 19,000 inhabitants. And now we have more families under quarantine, and measures are being so strict in that area in order to avoid the spread to other communities and to other neighborhood also. Thank you.
Shukran. Thank you.
And it's not about this particular village or the incident, it's about the stigmatization. And how can we overcome being stigmatized, whether a geographic place or individuals, you know, contracting or coming in contact. So in a way, we need to be more confident about what is really happening, and at the same time to stop the rumors and to stop the stigmatization in order to be able to deal properly with the containment of all situations.
Thank you. Very important point. Thank you, Dr. Maha. Dr. Abdel Nasser, the very last question, if you are with us.
Yes, I'm with you, but I think
I'll try to be. Actually, it's in Arabic once again. I'm sorry, but I guess the translation works well.
Would the high temperature and the coming of summer would lead to the retreat of coronavirus? The second part of the question, there are warnings of taking Roofin for allergic patients and for those suspected of corona. What's the fact behind the use of Roofin? Thank you.
Thank you very much. I think in the recent weeks, we have seen a lot of data coming from the different hospitals where patients are being given to ibuprofen or anti-inflammatory diseases in general. And I think this has been shown that the ibuprofen as well as other inflammatory diseases might not be helping the patients, rather they may have a negative side effect in regard to the alleviating the pain as well as the fever. And WHO as well as other communicable disease department around the world actually have recommended people not to use ibuprofen as well as anti-inflammatory diseases to alleviate the fever as well as the pain. And I think that's a very important to make sure that the progress of the clinical presentation of the cases, the ibuprofen has a negative impact and people should not take the ibuprofen. The second point of your question is the temperature, I think is the weather related to that, if I understood correctly.
Exactly,
I think
yes.
Yes. I think a lot of experts and scientists right now, they are monitoring the situation, the impact of the weather as well as the temperature in the progression of the COVID-19 outbreak between the cold weather as well as the warm weather in a different part of the site. And now we have seen some evidence where neither the cold side of the world, the southern part, as well as the northern part of the world where there's a warm, I think the outbreak is spreading, but still there's not enough evidence to justify whether the virus is more in the cold. But what we are seeing right now actually is in Asia as well as in the Middle East and Europe, where we have a cold weather, the virus is spreading and also mutating very seriously as compared to the warm side. And this is the area where there is a lot of investigation and study that's ongoing, and we will hopefully see more evidence in the coming days or weeks.
Thank you, Dr. Abdel Nasser, who is responsible for the program of emergency preparedness in WHO. Now I give the final speech to Dr. Ahmed Al-Mandari. The floor is yours, sir. Thank you very much indeed, Mona, for the excellent moderation of the session. Thanks is due to all colleagues from different media channels and media agencies, whether read or watched or listened to. And as you may know, we aim to convey the proper piece of information in the right way in a timely manner. Thank you very much indeed for giving us the opportunity as EMRO, as WHO EMRO, to engage with you in this session and to convey information to different parts of the world. As you may know, this pandemic is indeed rare, and it's a rare situation that world countries are undergoing at different levels, and we do hope that we would be successful in grappling with it, and we would draw lessons with the least losses, whether financial or human. There is a message, a specific message, which I would like to engage with you and to convey to all countries worldwide. Namely, we do call upon all countries with the different levels of development, resources, size, and population to follow a whole society approach and a whole government approach and also a whole approach inclusive of the government and the private sector, and includes all the spectra of society, all the brackets of society in all ages, to set forth a full-fledged strategy using this whole of government and whole society approach in order to save lives and to put an end to this pandemic. There are 4 main areas that countries should follow. The first key area is to be prepared and to be ready. As it is mentioned at all times and reiterated, being prepared and being ready is the first line of defense to guarantee grappling with the pandemic, to detect, protect, and treat, to detect the infected cases and to protect others from the infection, and to extend proper treatment for different levels of infection, whether mild or moderate or severe, to reduce transmission. As you may know, countries are following many procedures, many preventive procedures in this domain. Innovate and learn. This is indeed a great window of opportunity to learn from this pandemic. As has been said in different sessions and in different opportunities, science is limited, so it is opportune to come up with innovations and creativity and to come up with solutions that would protect the population and citizens and would save time and effort for upcoming generations. Particularly, there are messages that I would like also to convey to different countries to activate and scale up their emergency response mechanisms as well as their pandemic preparedness plans, as done at the moment, to enhance coordination and planning amongst all stakeholders and partners at national and international levels. And this this includes providing financial and human resources from different supporters and donors. And as has been mentioned previously, we are undergoing this pandemic and we do have huge needs, and we hope donors would provide what is needed to communicate with communities about the risks and how they can protect themselves. Again, this is an excellent opportunity at health systems as world organizations to instill positive culture among citizens and populations with regards to preventive procedures in all walks of life relevant to health, whether the proper food diet, practice of sports to avoid tobacco intake, and personal hygiene. We need to follow this in our health systems, to find, isolate, test, and treat every case and trace every contact. And this is a live lesson learned from our health systems that we endeavor to strengthen at all times via international health systems, which is called IHR 2005, to raise level of preparedness in hospitals. As it is well known to everyone, many countries are apprehensive and concerned vis-à-vis the increase of confirmed cases. Hence, they need to hospitalize patients according to the case, whether mild, moderate, or severe. So we need to strengthen hospitals and healthcare settings. And most important, and above all, is to protect and train health workers properly in how to deal with this pandemic and also with infected patients, because they are the first line of defense and extension of proper medication to infected cases and also to prevent it as well. Finally, I would like to thank you very much indeed, and I do wish you all success, Godspeed, and guide you. Thank you.
Thank you, colleagues. Those who are connected, enjoy your quarantine. Thank you.